All right, welcome to part two. I did not change the background, but we could change it to the intestines, but we'll just keep it as the stomach here. So, all right, so here in part two, let's talk about diarrhea. So, um, with our focus being on the drugs, of course. So, right, so these are drugs that are going to change something about motility, either something about motility or reducing the secretions that contribute to this, the squirts. Um, and as we said, just like everything else, this is normally a protective mechanism to help get irritating or toxic substances out of your body. But it can get out of control and lead to dehydration and even death. So the number one cause of death in children in the world is dehydration from some sort of infection. Some terms that will help you here, terms I'm going to I'll use, and they're in the book, but I think it'd be helpful to know. So here we are. One term is this word lumen, the word intestinal lumen. And that just means that space, your intestines, your stomach, right there, this tube or space, that's the lumen. So here we are in the lumen of the small intestine. There's those little finger-like projections you saw in the first part. And then here's cellulose and starch, and there could be proteins and fats, right? They're all here in this lumen, and they're going to get broken down by enzymes and get absorbed, right? Absorbed into the bloodstream. So that's this word lumen. You're going to hear me say that a lot. And this word intestinal wall kind of refers to the layers of the intestine. Usually when we say intestinal wall, we just mean this first layer. So let's just look at that first layer here. The first layer is called the mucosa that lines the lumen, and it's made up primarily of epithelial tissue. Below that, we have what's called the submucosa that has a lot of blood vessels, um, lymph vessels, and glands. So when food gets absorbed, or when nutrients get absorbed across the mucosa, here's all the blood vessels that are going to take it off to the hepatic portal vein and the liver, and then to the body. These various parts of the digestive system have to move, right? They're going to mix and move food forward, and that's the job of the muscle layer. So you've got smooth muscle, just like you have smooth muscle in your esophagus, smooth muscle in your bladder, in the uterus. It's not under conscious control. And so there's smooth muscle there. And then finally, kind of holding it all together, you've got the serosa, which we don't really care that much about today. But knowing about the mucosa, the submucosa, and the muscular layers, just kind of keeping in mind where those layers are, will help you understand things. So, so what is diarrhea, right? There's this balance, right? We've got a certain amount of food coming in. We need to remove water. We don't want to remove too much water. But anytime there's an imbalance between fluid that's being secreted from the body into the intestinal lumen, or fluid being absorbed from the lumen into the body, is going to result in more fluid being either secreted or remaining in the feces, right? That's diarrhea. We need this balance of secreting fluids and reabsorbing fluids. And there's 4 forms of diarrhea, and I think I can do a pretty good job of explaining them. So they're called osmotic, secretory, exudative, and motility. That is not in the order of how common they are. The most common is probably motility. But if you understand them, it helps you understand treatment. So first we'll talk about osmotic diarrhea. So we've learned about osmosis when we talked about diabetes, you learned how the glucose in the nephron has an osmotic effect on water. The glucose in the urine is going to attract water to it, and that's one reason why patients with diabetes mellitus make so much urine, right? It's osmosis. Um, well, when there's certain particles in the intestines, it draws water to it. One example would be undigested food particles. Patients have this disease called exocrine pancreatic insufficiency. This is mainly a problem in dogs, especially like German shepherds, but you could see it in cats too. And so it means the pancreas is not making enough of those enzymes. So all this food comes in from the stomach into the small intestine, and there's no enzymes there to help digest them, right? To help break them down further, and so they just act like they just attract water. They just act like little osmotic particles. You remember we talked with osmosis, like putting, if you were to sprinkle salt on a slug, right? Osmosis is going to draw water out of the slug. But I know you would never do that. Um, um, that's what happens here. All these undigested food particles draw water in. Now there's too much water in the intestine, and that's going to create diarrhea. And just to show you, again, German Shepherds, we can see this in any dog, but it seems to happen more often where in the young developing German Shepherd, their pancreas just doesn't become fully formed. And so they tend to have these poops that are kind of greasy and gray. They just don't look like normal poops. They're greasy because there's fat in them. They're not able to digest fat. And these patients are really skinny because all this food is just passing right through them. The treatment we'll talk about a little later, but it's powdered enzymes. We give them powdered pancreatic enzymes, and now they can digest their food. If they can digest it, then they can absorb it. So that's osmotic. Another kind of diarrhea is called secretory. So it means to secrete or secretions, oozing, if you'd rather use the word oozing, right? Like slugs, and they secrete slime. What's happening here are there are various toxins made by bacteria. Usually this is some sort of a bad bacteria. This is not a normal bacteria. So this would be something like E. coli or salmonella. Is causing this excess oozing of fluids. Inflammation could do this too. So now osmosis is not the problem. The problem is now we're just oozing too much fluid into the intestines. And this is certainly what happens. You'll hear about cholera outbreaks. Back a few years ago in Haiti, there was, I think it was a hurricane, or I'm sorry, it was an earthquake, but pipes burst, and wastewater that was normally separate from drinking water got all mixed up, and people got cholera. And you can just see all these IV fluid lines going to treat dehydration. It's really horrible. So this cholera causes a secretory diarrhea. And this little video clip just kind of shows you this is for humans, but it just kind of shows you the first two. And I will attempt to narrate this. So I think that's supposed to be a person in the bathroom there. And okay. So again, we talked about osmotic diarrhea. So again, in the normal, normally there is wait a minute, that's a little annoying. Hold on, let me back up here. Right, so you can see normal, we've got water getting reabsorbed from the intestines, but with osmotic diarrhea, there's not very much water getting reabsorbed. Instead, the water is staying in the lumen. in the lumen of the intestine there. And again, I think they give the example that in people, a person who's lactose intolerant, eating a lactose product will cause an osmotic diarrhea. So again, there's just fluids not getting absorbed. Instead, it's just staying in the intestines because there's some particle, lactose or undigested food, that's attracting water into the intestines. So that's osmotic. Oh, sorry. Now here's secretory, where he said something's making the walls ooze more. Salmonella, really nasty E. coli could do that in people. Cholera will cause that kind of diarrhea, right? There's cholera right there. So, okay. A third form of diarrhea is what's called exudative, where there's some, this one to me, it overlaps a little bit with secretory. With secretory, there's no damage to the walls of the intestines, but with this one, there is damage. There's some damage like from parvovirus or panleukopenia in cats. It's causing leakage from the blood vessels from the wall into the lumen. So electrolytes and plasma proteins and sometimes blood is all coming in, and that's going to create diarrhea. Transmissible gastroenteritis in pigs causes damage, and it's actually, that's a type of coronavirus actually. And this showing you, this is what parvovirus does. So this is one of those little fingers, those finger-like projections you saw in a normal dog, but in parvovirus is attacking all these epithelial cells, and now fluid is just going to start oozing out. And this is not what intestines are supposed to look like. But this is what the intestines of a dog with parvo, or a cat with panleukopenia, or a pig with transmissible gastroenteritis, this is what it can do. And the fourth kind is the kind you're probably going to see the most, what we call motility diarrhea, where it's just things are moving through too quickly. They're moving through without proper digestion of food or absorption. So, a dog maybe eats something, some garbage, and the body is trying to get rid of it. Right, so first you're just going to see a normal food is traveling through the colon on its way out to the rectum, right? Sort of normal, rhythmic motions. But then you're going to see hypermotility. You'll see where the motility is increased. And now, right, this is normal. So we're still at normal, right? There's a normal bunch of feces traveling through. There's water, right? The colon's big job is to absorb water. So there's water getting reabsorbed. And now it is in the rectum, and then your patient goes to the bathroom. And now let's see what happens when there's excessive motility. Right now, it's hypermodal, and now the feces is traveling through much too fast, and there's just not enough time to absorb water. And so by the time it reaches the end, there's still a lot of water that was never reabsorbed, and that's going to be diarrhea. So how do we treat diarrhea? Well, honestly, a lot of diarrheas we don't treat at all, or we might do a little something for, but there are some kinds of diarrhea where it's just so frustrating that we need to do something. So how do we use anti-diarrheal drugs? Well, either they're going to modify intestinal motility, and sometimes they do more than one. They may block the secretions by having some effect on the underlying problem, such as reducing inflammation. That's probably the big thing we use. We also have some antibiotics we use, but we're going to focus on drugs that reduce inflammation. And there are even some drugs that will adsorb toxins, not absorb, but adsorb. And we'll talk about that. So to understand the drugs that modify motility, it's sort of helpful to know, well, what is normal motility, right? I keep showing you this little clip here of this sort of this movement of food, of poop through the intestine. So let's talk about what's actually going on here. In the intestines, there's smooth muscle, right? You saw that, and there's actually two different kinds of, they're arranged a little differently. You've got some smooth muscle that kind of wraps around like that. Oops, let me pause this, hold on. Let me find a good spot to pause, all right? Well, let me try again. So you've got some smooth muscle that kind of wraps around like that. I'm going to try to do a little dotted line here, right? So it wraps around like that, right? And when that contracts, it does what's called a segmental contraction. It kind of squeezes like that, right? It's not moving things forward or backward. It's just kind of mixing. You also have smooth muscle that runs parallel to the intestines. And when it contracts, it's going to move food forward. And actually, altogether, they actually move food forward and backwards. It's sort of, 3 steps forward, 2 steps backward. Again, just trying to mix and move it, ultimately move it forward. So that's normal. Now, the chapter goes into a lot of detail about hypermotility and hypomotility. And sort of the bottom line is that reducing peristalsis, right? Peristalsis, that's that forward movement. Reducing it a little is good. If you reduce it too much, then it's bad. It actually will make things worse. But and actually in segmentation, there are some drugs that increase segmentation. That's the circular smooth muscle. And that if we can increase that, that'll actually slow down diarrhea. So, but what you really need to know is this, tenesmus. So tenesmus is basically describing a patient that's squatting. They're squatting to defecate, but it's not because they're constipated. It's because there's inflammation of their rectum. And so you'll see, owners will see these patients squatting, their dog will be squatting like that, and they'll assume they're constipated. They're almost not constipated. They're usually not. They usually have diarrhea. And it just hurts and burns so much that they keep squatting like that. So that's tenesmus. They're squatting, they're shaking, they feel like they need to go, there's just nothing there. Tenesmus can also occur from like urinary blockages and things like that, but we usually think of it as being inflammation from diarrhea. But it could be any of these things. All right, so what can we use to modify motility? Well, you may have heard of drugs like Imodium and Lomatil. People take that often if you're going to get on an airplane for a long ride and you don't want to run to the bathroom every few minutes, you might take Imodium. You got a long car ride, right? So people, that's why people use these drugs. They're going to decrease the flow of diarrhea. They'll decrease secretions, and they actually increase those segmental contractions that we mentioned. So Lomatil and Imodium. When would we use them? Well, primarily not very often. Most of these patients, they have some sort of garbage in them that we want out. Maybe they have Giardia, maybe they have whipworms, maybe they have coccidia. We don't want to slow down diarrhea. We want all those parasites to get out of them. But there are some times where an owner says, I've got a 6-hour car ride with this dog tomorrow. Well, then I may say, okay, for one day, let's use Imodium. Um, or, or the dog may have some other diarrhea. We don't think it's from a bacteria or a virus or a parasite. But we just want the owner and the dog to sleep through the night. We don't want the dog to be, we don't want the owner to wake up to the worst poop dance in the world. Poop dance is where the dog poops and then kind of dances around in it. So we might use it, it's not really helping the patient. It's just creating some less problems for the owner. We would definitely not want to use it if there was some sort of infection there. So a parasite, a virus, a bacteria, we're just going to, it'll take them longer to get better if we slow down diarrhea. So there's a potential risk for abuse. This is an opioid. They combine it usually, it doesn't mention it on there, but if you look at the label, they combine it with atropine. Atropine is an anticholinergic, so it creates sort of a fight or flight feeling. So if a person tried to use this as an opioid for substance abuse, they'd get a dry mouth and a tachycardia. So it can cause some CNS depression because it is an opioid. It can slow down things too much. We call that ileus. Ileus is also called gastrointestinal stasis. May not be a bad thing in you and me, it's not good, but it can be really dangerous in a rabbit or a horse. So bloating, constipation, right? Just what you'd expect if you're slowing down the motility. This is also one of those drugs, well, opioids in general are one of those drugs that certain breeds may be extra sensitive to. So you recall we learned about how collies can have this defect of the P glycoprotein pump, right? That's that little pump. Its job, it's found in the lining of the intestine, and it pumps drugs back into the lumen. It's also found in the blood-brain barrier, and it pumps drugs back into the bloodstream out of the brain. Well, certain breeds like collies, they have defective pumps. And so what may look like a small dose or a normal dose becomes an overdose in these patients. So, I mean, you could still use Imodium. You just, need to be aware that we may need to lower the dose. I mean, the main thing is a client may call and say, oh, hi, my dog has a little diarrhea. Can I give my dog Imodium? And it's very tempting to say, oh, sure. But remember, if that dog is a collie, an Australian shepherd, any of these breeds that are prone to this defect, we don't want to just off the bat say, sure, what harm could Imodium do? Well, it could cause excessive CNS depression. It could cause constipation. Okay, the next group of drugs we'll talk about are ones that are going to help with inflammation, right? So excessive inflammation increases GI secretions, and that's going to cause diarrhea. And you'll see that here. This is I think, part of the colon, right? And just see all this inflammation occurring along the wall, right? That's going to create more oozing of fluids, and that's going to cause diarrhea. So there are certain drugs that are they'll block the local production of inflammatory prostaglandins. Recall, we learned about prostaglandins. There's good prostaglandins, but these are the bad prostaglandins, the one we associate with redness, swelling, and pain. And so these are going to block production of those prostaglandins. That means less inflammation, and that means less GI secretions. And the two that we use are called bismuth subsalicylate and sulfasalazine. So you probably know bismuth subsalicylate as Pepto-Bismol. Um, it's actually two drugs in one. Bismuth, we'll talk about again in a moment. It actually kind of coats the mucosa and protects it from the toxins. And it actually has some antimicrobial activity. But the main thing we're talking about here is that subsalicylate. That's an aspirin-like compound. Aspirin is acetyl salicylic acid, and salicylate is very similar. And what do? They block the formation of the inflammatory prostaglandins, right? They're going to inhibit COX. COX is cyclooxygenase. Well, why not just take aspirin, right? Why not just take, if you have diarrhea, take some aspirin. Why not just take some carprofen or meloxicam? Well, remember I said the intestinal tract is outside the body. So you can take aspirin, you could take carprofen, but it may not be very effective against inflammation along the mucosa. The other thing we learned is that these drugs, what's one of their main side effects is they can interfere with the good prostaglandins. And there are good prostaglandins that help make mucus. And you'll see later in part 3 how that can lead to stomach ulcers. So for diarrhea, even if it's due to inflammation, the anti-inflammatory drugs don't really help. They can't really reach the site, and they can actually make things worse. But this one, subsalicylate, it's there. You deliver it directly to the intestines, and then it can fight inflammation there. A side effect that's kind of important to know, it's not harmful, but it'll make the patient's stool look dark and tarry so that it resembles melena. This is not melena. Again, melena refers to when there's bleeding in the stomach and then the blood digests and turns black. You get this sticky black poop. This is not melena. It just kind of looks like melena. And so again, owners may give their own dog or cat Pepto-Bismol. They come in and you see this, we're going to think it's melena. So this is again where a good history may prevent us from overreacting. These often come in flavors. I don't think dogs really like these flavors like peppermint and cherry. And again, an owner may call and say, oh, my dog has a little diarrhea. Can I give him Pepto-Bismol? We have to be very careful about what we say because, again, if it's strong enough to help, it's strong enough to hurt. And if they give too much of Pepto-Bismol, they could cause a salicylate toxicity. I don't actually know what that would look like, but the point here is that you can overdo anything. The other drug that's similar to this is called sulfasalazine. Again, this is a local anti-inflammatory. You learned about it a little bit when we talked about antimicrobials. This is a sulfa antibiotic, although it's not really much of an antibiotic. It doesn't do much by way of killing bacteria, but it has this aspirin-like compound called mesalamine, and like bismuth, it's going to block formation of inflammatory prostaglandins. So, and I love sulfasalazine. It's really helpful, a really helpful drug. In my experience, it's much safer than these sulfa antibiotics. And do you recall a very important side effect, or I shouldn't say side effect, adverse effect of the sulfas? So it can cause that condition called keratoconjunctivitis sicca, also known as dry eye, where it'll make the eye produce less tears. So that's, something we need to prepare owners for. But like I said, I haven't seen that happen with sulfasalazine. And then a final drug we can use, this is a little funny because I don't really think any veterinarian uses these for diarrhea, but still, we can talk about it. So there are certain drugs that protect and act as adsorbents. And we've already talked about one of the protectants. Again, these are drugs that are going to coat and protect the intestinal mucosa. You could kind of call them a liquid Band-Aid. There's another drug we'll talk about later, which is used for stomach ulcers. That's called a gastric Band-Aid. That's really wonderful. But we can call this one a liquid Band-Aid too. And again, this is the bismuth in the Pepto-Bismol, right? And some drugs can be both protectants as well as adsorbents. Now, absorbents mean that they're going to cause toxic or irritating or disease-causing molecules to stick to the drug, right? They're not going to get soaked up like a sponge. They're just going to stick to the drug. It's not, whether you think of it as absorbing or adsorbing, it doesn't matter that much, but that's not a typographical error. It is called adsorb, and it just means sticking to the surface. And the main drug that we use for that is called activated charcoal. And we're going to talk more about activated charcoal in a moment, but that's what you're seeing here. That dog is being given this black charcoal stuff. It actually tastes delicious. It has a good taste, kind of a sweet, chalky taste. But it's messy. It takes a lot of patience. It's very tedious to give. But we use it again, they're using it here for diarrhea. We use it for usually more to help with poisonings. And so I'll talk more about that in a minute. Another drug we use is called barium. Now this is kind of funny. It's primarily used when we take X-rays. It's called a contrast medium, and when we give it, it'll light up on an X-ray. It's very radio opaque. And so here's a dog lying on his back. This dog's in ventral recumbency. I guess that would be, sorry, dorsal recumbency. And the dog's been given barium, this liquid, and then immediately after they took an X-ray, and you can see how quickly it's left the stomach. There's the stomach, and there it is traveling through the duodenum. And we use this when maybe we're suspicious of a foreign object that we can't see. Maybe there's a tumor, maybe there's some sort of a stricture. So we can follow the barium through the gastrointestinal tract, and it'll sometimes outline a stricture or a foreign object, like a piece of wood or a rubber ducky. That won't show up on an X-ray, but we may be able to see it with barium. So you can see after 30 minutes how fast it's traveling. I shouldn't say how fast, that's just natural. After 60 minutes, right? So we take an X-ray every half hour or 15 minutes or an hour, and we just watch it travel through. Well, barium also has some protective effects as well as some absorbent effects. So we will sometimes give a dog that has vomiting and diarrhea, we'll give them barium, and the barium makes them feel better. I mean, like, the barium was not only diagnostic for these X-rays, but they also made the stomach feel better. So that's a really common situation. Okay, let's say a little more about activated charcoal. I really love it. I love how it tastes. I love how it can help patients. Again, it's going to adsorb various toxins to its surface and then carry them out of the dog or cat, right? That way they can't be absorbed, they can't do damage. It's not effective against xylitol. That's that artificial sweetener. That's just too small of a molecule. For some reason, it's not effective against heavy metals. If a dog ate lead, for example, it's not effective against petroleum products, like if a dog ate gasoline. But what is it effective against? Well, all of those toxins I showed you earlier. So the dog that ate chocolate, we might make them throw up and then send them home with activated charcoal, right? Dog that got into rat poison, make them throw up, but give them activated charcoal, right? So if anything they didn't throw up, the activated charcoal may grab onto and then they'll poop it out. It's just very important to tell owners that the dog is going to have black poop for at least a day, and they may need to go a little more often. And so they don't want to wake up to a big pile of black charcoal poop in their living room. So they may want to get up once or twice in the night to let the dog out. And then the final thing we'll talk about in part 2 is constipation, right? So why does it happen? We talked about cats can develop this problem with the colon, where it just gets all stretched out and loses its muscle tone, and they'll just have this recurrent chronic constipation. If a dog has some sort of a neurologic problem where they're recumbent, so a dog with a herniated disc, for example, they just can't get up and move around, and so that slows down the passage of poop. You know, it's how regular exercise is good for regular bowel movements, and so patients that can't can develop constipation. Patients that have some sort of a pain, maybe they fractured their pelvis, maybe they just had surgery done on their anus, it hurts to strain, and so what happens in all these sort of cases is now feces is moving through too slowly. And remember, the big job of the colon is to absorb water. And if anything slows down the movement through the colon, more and more and more water gets absorbed, and you end up with this sort of dry constipation. So what can we do about it? Well, we can use things called laxatives and cathartics. Again, the book doesn't even mention a purgative. A purgative is it's like the most aggressive kind of a laxative. But if you've heard the word purge, right? They just clear everything out, but we just don't use them in animals. So we really just use laxatives and cathartics. So again, their goal is to increase the fluid content of the feces, to make it softer and easier to pass, or they promote defecation. That's what cathartics. So laxatives tend to soften poops. Again, we use them for all the examples I just gave. Colic, you might use it in a horse that has an impaction from colic. Some animals like cats who groom themselves a lot, they'll get hairballs. The fancy word is trichobezoar, but it's just a hairball. And sometimes we need to get a good x-ray of the colon, and so we might use these just to help clear out the colon. So what's the difference? Again, a laxative is going to be sort of a gentle stool softener. A cathartic, its job is to evacuate the bowel, and then a purgative, like I said, is a very harsh cathartic, but we're not even going to mention that. So laxatives, they fall into two categories. Now, before I say anything else, the greatest laxative in the world is actually water, right? So, for example, if a cat has megacolon, we want him to drink water. And we'll talk about feeding them canned food, adding water to it, getting a circulating water bath. So water is really the greatest laxative. But when we need it for constipation, we can only get so much water into them. But sub-Q fluids, IV fluids, these can all help with constipation. The actual medications that we call laxatives fall into two categories. So there are what are called emollient laxatives and bulk laxatives. An emollient, if you've ever seen hand lotions, right, they're sometimes called emollients. And so these would be oils and stool softeners that are going to help to soften the poop. Bulk laxatives, they tend to pull water into the bowel, or they help the actual feces to retain water. So fiber, you hear the word bulk laxative, just think fiber. And so examples of the emollients would be mineral oils, petrolatum, like oh, what's that, like things basically like Vaseline. There's something called docosate sodium succinate. It gets mentioned later with cows. I think it's spelled a little different. That's not an oil, but it will help to pull water into the feces. And then again, the goal here is to ease the passage of stool for either patients who are constipated, but mostly for patients that might be at risk for constipation. My dad had a terrible accident last summer, and they put him on stool softeners. He had nothing wrong with his gastrointestinal tract, but he was bedridden for like a month, and they knew he was at risk for developing constipation. Well, he was on opioids, and opioids can cause constipation too. And so that's another reason why we might use laxatives. And of course, they can help with hairballs. So for example, here's a horse who has an impaction colic, and they're pumping mineral oil. They have a tube that's gone down, it's gone in the nose and now down the esophagus. So they're giving mineral oil to the horse. If you've ever seen things like Laxatone for hairballs, you know, that's basically petroleum jelly. It's kind of like an edible Vaseline. And then bulk laxatives, we call them fiber. Sometimes we'll have patients, we can just sometimes give them Wheaties, or a scoop of bran, of wheat bran. But you can also use things like psyllium, found in products like Metamucil. Again, we're kind of creating not diarrhea, but we're creating an osmotic force. These are big particles that are going to attract water. Cathartics, we said their job is to empty the bowel, and there's a few different types. Some are called osmotics, so there's that word osmosis again, and then some are called irritants. We don't use the irritants very often. Osmotic cathartics come in some different forms, sugars and salts. The salts are primarily in the form of, mostly you're going to use them as enemas. So a dog comes in who's constipated, we may give them an enema, right? That's this tube. It's going to get lubricated and go up the dog's anus and provide this sort of high salt enema that's going to help draw water and then hopefully loosen everything up so the dog can defecate. We can't use these in cats. There are some that are made for cats. This one says for dogs and cats. But there are some that are only made for humans or dogs because they have too much phosphate. So we have to be careful. Make sure it says safe in cats. With cats with cats they usually tend to contain other things to make them poop. So like, for example, a phosphate enema is one we would not want to use in a cat. The other osmotics we can use, these ones are safe in cats. These are a sugar cathartic. So they're not going to screw up any electrolytes. And the one we use is called lactulose. So this is a kind of a sugar. I've never tasted it, but apparently it tastes, apparently cats hate it. I would think it would taste good. It's a sugar, but cats really hate it. And so we can use it as an enema. Cats who have megacolon will have owners give it usually twice a day, but cats really hate it. It's also used for a totally different reason that has nothing to do with constipation, and that's a condition called hepatic encephalopathy. So hepatic encephalopathy, hepatic means liver, and encephalopathy refers to a disorder of the central nervous system. And in particular, this is a change that occurs in mentation or behavior due to ammonia building up from some sort of liver disease. Ammonia is a toxin, highly toxic. Your liver converts it into urea, but in these patients, the liver just can't do that. And so the ammonia has all sorts of horrible effects on mentation. Those of you who took clinical lab techniques, there's a video I'll show you from last semester. And the way it works is it just changes the pH in the colon so that ammonia doesn't get absorbed as much. And this was a video I showed you last semester. This dog, the owner might think the dog is senile, but if we watch long enough, we see the dog is like just pacing and walking in circles. And sometimes these dogs will push their head up against a wall. And there's really nothing wrong with his brain. He just has liver problems with really high ammonia. But you just kind of just pacing and walking in circles all the time. And just as a side note, pumpkin is a kind of fiber. It's a soluble fiber, not an insoluble fiber. And we can actually use pumpkin for a lot of different things. We can use it for constipation. It also helps with diarrhea, if you can believe that, because the soluble fiber is an energy source for the mucosa, for the cells of the mucosa. So just make sure that clients, if the veterinarian is recommending pumpkin, make sure it's pumpkin, not pumpkin pie filling. Okay, that's it for part 2. Take a little break, get up and stretch, go try the Kahoot. Again, the questions are pretty basic, but there'll be a chance to kind of review what we've learned, and then I'll see you in part 3.